Hi guys, so today I'm going to be talking about the 2-point discrimination test or the 2PD. So first we're just going to start with a general description. So the 2-point discrimination test is really the ability to discern that two nearby objects on your fingertips are two distinct points, not one. So what areas it assesses, it looks at receptor density, mapping improvement after nerve repair, and it determines if a client can feel something, but also what they're feeling. So for age range, I did find one article that used it with children. It said that it can be used with children that are 6 years and older. You have to keep in mind their ability to understand the test, their ability to follow directions, their ability to keep attention on the assessment, and just their overall maturity level. So this is considered to be a functional sensibility test. It specifically tests the peripheral nervous system. The length of the assessment varies with each client. It depends on how many fingers you're going to test, and if you do it in the standardized way. For outcome measure, you can use it for progress notes to show sensory improvements over months. You can use it as an evaluation for workers' comp. You cannot use it for writing goals though, because a therapist cannot improve sensation. Okay, so now administration. There are actually two tests that fall under the 2-point discrimination test. So the first one is the static test. So you have the client close their eyes and lay their hand down, palm up. So you use either a discriminator or a bully gauge with blunt testing ends, and those are the pictures on the bottom of the screen. You randomly test 1 or 2 points on each fingertips for 10 applications beginning with 5 millimeters. You apply the testing points parallel to the longitudinal axis of the finger, and that is seen in the picture below with the black tool. So when you apply the pressure, you want to stop testing when the fingers blanch. So you want to press hard enough where they can feel it, but not light enough where they can't feel it. The client will either respond that they feel 1 point, 2 points, or I don't know. And depending on the accuracy of their response, you either increase or decrease the distance. Okay, so the other test that falls under the 2-point discrimination test is the moving test. So you virtually do the same thing. So you have the client close their eyes, and for this one, you begin with a distance of 8 millimeters. So what you do is instead of just poking them with it, you move proximal to distal on the distal phalanx of the fingertip, perpendicular to the longitudinal axis of the finger. So if the client responds correctly, you decrease the distance. If they respond incorrectly, you increase the distance. You have to apply it perpendicular for this test because if you apply it parallel, it actually feels like 1 point when you apply the 2 points. And just another thing to keep in mind as a clinician is that moving actually returns before static and is a sign of recovery on the 2-point discrimination test. So this is something to look for in your client. So for scoring, if you do the standardized way, you record the distance where the client can accurately report 7 out of 10 applications, meaning for each distance you do 10 trials. Okay, so these are other things to keep in mind when administering the test. So with many clients, you actually don't need to do 10 trials for each finger. So if you start with 5 millimeters and you do it 3 times and they accurately report the amount they feel 3 times, you know they can discriminate that distance and you can immediately decrease the distance, decreasing the time needed for the test. You just need to record in your SOAP note that you did it differently. Normally you don't test the unaffected hand just because this is such a specific test, but you could use it to explain the directions as you'll see in the video of me with Alina. You typically don't test all the fingers. If you think about it with carpal tunnel syndrome, it really wouldn't make any sense to test the pinky. And you don't always have to start with a standardized distance. So if you feel like they have better discrimination, you could start with a smaller distance. Some clinics don't have a bully gauge or a discriminator tool. They actually have paper clips bent to different sizes. So this is just something to know if you run into this someday. You only test static once the moving is normal. So as I said on the previous slide, moving comes back faster. So once moving is normal, you only test static. And then one other thing to keep in mind is this test is used with workers' comps. So losing sensation on the job is a really big deal. So you want to make sure you're doing it the standardized way. You want to do 10 trials for each distance. You don't want to maximize or minimize their injury because it actually does determine how much money they receive, so it's considered a high stakes number. Okay, and then this is my video demonstration.
This picture shows the 3 tools available in the assessment room for the 2-point discrimination test. The gray discs are the discriminator tools. The dark gray disc has the distances you start with, and the light gray disc has the larger distances if the client continues to respond incorrectly. The discs have been shown to have good inter-rater reliability and are the preferred choice among therapists. The bottom tool is called a Bowley gauge. The black bar is slid down to create the distance that you are testing. Hi, Lena.
Hi.
Today we're going to be doing the 2-point discrimination test. So this is like a functional sensibility test. So we're just going to differentiate between your ability to feel 1 point and 2 points on your fingertip. So if you could give me your hand that's not experiencing any symptoms, I'm just going to show you how it works. So I'm going to take this tool and I'm either going to poke you with 1 or 2 points, and you're going to tell me if you feel 1, 2, or I don't know, and you'll have your eyes closed. Does that make sense?
Yes.
Perfect. All right, Alina, I'm going to have you close your eyes and I'm going to begin the test. You're going to feel it on your pointer finger first. So remember, just say 1, 2, or I don't know.
Okay. 1, 2, 2, 1, 2, 1, 1, 2, 2, 2, 1, 2, 1, 2.
In the beginning of the video, I explained the purpose of the test on Alina's non-affected hand. For the purpose of the angle of the video, I continued testing on her non-affected hand, but in real life, the therapist would have switched to her affected hand as this is such a specific test. Alina continually got 7 out of 10 correct, so I continued to decrease the distance for the static test. Based on her performance, it would be documented that Alina got 7 out of 10 responses correct with a 2 millimeter distance, indicating normal 2-point static discrimination. All right, Alina, so we just finished the static test, so there's actually also a moving test, so I'm going to have you put your hand out again. So for this test, instead of just poking you with it, I'm going to drag it down your finger like that, and you're going to tell me 1, 2, or I don't know. Does that make sense?
Yes.
Perfect. All right, Alina, I'm going to have you close your eyes and then we'll begin the test.
Okay.
Are you ready?
Yes. 2, 2, 1, 2, 1, 2, 1.
Alina continually got the first 7 responses correct, so I continued to decrease the distance for the moving test. Note the position of the discriminator tool compared to the static test. The prongs are now perpendicular to the long axis of the finger rather than being parallel. Okay, Alina, we're going to do the static test one more time, so I'm going to have you close your eyes. Okay, so are you ready to start?
Yes. 2, 2, 1, 2, 2.
This final video of the static test shows the non-standardized way of completing the 2-point discrimination test. Rather than doing 7 to 10 trials for each distance, once Alina has correctly answered the first 3 out of 3 correctly, it proves to me that she has good discrimination for that distance, so I move the distance down. This decreases the time needed for the test.
2, 1, 2.
Perfect. Great job. That's the end of the test. This picture shows the 3.
Okay, so now we're going to talk about some psychometrics. So I'm going to start with some norms. So from our textbook, the general norms indicate that for static, 1 to 5 millimeters is normal, which is what Alina got. 6 to 10 millimeters is fair. 11 to 15 millimeters is poor. And 1 point is protective sensation only, and no points means it's anesthetic, they can't feel anything. For moving, 2 to 4 millimeters is normal for ages 4 to 60, and 4 to 6 millimeters is normal for 60 or older. So I found one interesting article on does age affect the norms? So they actually found that the normal sensibility of the hand peaks in the 3rd decade of life and declines afterwards. So they suggested using the Delta 2-point discrimination test that takes into account normal values for the client's age and their inter-individual differences. So meaning the difference between the hand with an injured nerve and the hand and their other hand which is not injured. And then on the next slide, I'm going to talk about like norms for different fingers and different tasks. So the top chart is norms for different tasks, and I thought this was very OT. So it talks about for sewing, you need like 6 to 8 millimeters, and for handling gross tools, you need greater than 15 millimeters. So I think this is just something to keep in mind as an OT, considering their occupations. And then the chart below, I thought was interesting because it just shows like the discrimination for each finger. So if you look at the table for the right hand, even though for each finger the discrimination was the same, it just is something to be aware of that people could have different norms for each finger. Okay, so now reliability. I did find one study on carpal tunnel syndrome. So it was done with 86 adults with unilateral right hand carpal tunnel syndrome. So there were 2 examiners that performed the 2-point discrimination test on the first 3 fingers of the participants, which shows what I proved earlier. You really test the fingers that you're looking for the diagnosis in. They had inter-rater reliability of 0.96 to 0.97, which is good, and they had intra-rater reliability that was at least good or even better than that. And then just because there's so many tools, it's important to understand the reliability of each one. So I did find one good study. So it had good inter-rater reliability with the discriminator tool. So this is because it has a consistent probe diameter and it has a standard distance between the probes. It had the smallest standard deviation compared to the bully gauge and the paper clips. So really the disc was the most favorable and the paper clips were the least favorable. And then for validity, so one article I found said that the test is a good predictor of the need for operative treatments in hand trauma patients. So the statistical analysis revealed a sensitivity of 98% for the 2-point discrimination test. And if you remember from the cervical lecture, if something has high sensitivity, it has the ability to detect when people have it, and it also has a low number of false negatives. A positive predictive value of 96% was also demonstrated. So overall, the results of the study showed that the 2-point discrimination test is a valuable examination to diagnose nerve injuries of fingers in hand trauma patients. And then one other article just showed that there was a strong correlation between the 2-point discrimination test and object identification, which is very OT because that is related to function. Okay, so bias. One thing that I did think about is callus on the finger. So we're always considering people's occupations. If you have like a construction worker come in for like workers' comp, you might have to consider callus on their fingertips. If you've ever had a callus before, you know it changes the way you feel things, and you most of the time have decreased sensation. Another thing that can cause bias is the amount of pressure the therapist applies. You really want to practice with the tool before you use it with a client because it is very easy to press it too hard without realizing it. And then another thing I just wanted to bring up is just the chance of malingering. Because of the workers' comp, they might have a motive for not wanting to go back to work or wanting to receive more services. So it's just important to note the client's behavior throughout the assessment. So these are my discussion forum questions. So my first question is, why do you think moving 2-point discrimination returns before static? My next question is, what other conditions could you use this test for? So I really want you to think specifically about the peripheral nerves being tested. So I talked about like hand trauma patients and carpal tunnel syndrome throughout the presentation. And then finally, since the test does not have a scoring sheet, how would you document the results of the 2-point discrimination test on a SOAP note? And you could either talk about the moving or the static tests. And then these are my references. Thank you for watching.